Is it? All right, so this should be recording us now. Now we'll go back to here and from the current slide. Okay, so let's proceed, and hopefully we'll have a file to post. All right, cryotherapy, resembling skin. Remember when something resembles something? It was like robots. Your phone. Yeah, because Andra is like a anyway. So it's a dermoid, and then pertaining to under the skin. You don't know that one. Or subcutaneous. Yeah. Anhidrosis, abnormal condition without sweat, cold therapy, resembling skin, and pertaining to under the skin. Okay. If you stop breathing and you are experiencing a oxygen deficiency, you will be what? Cyanotic. I'll buy that. And the condition of sweat, see, that doesn't even make sense. Well, that would be like an inflammation. Oh, esis. Okay, that doesn't mean necessarily it's bad. It just means it's just you have sweat. Let's look at esis. I don't have time for that. All right. Softening of the nail. Onychiomalacia. Okay. Onychio or onycho is the nail. Malacia is softening. You also see osteomalacia. Thank you. So onychomalacia is softening of the nails. Okay. White cell, black cell, skin that is dry, transplantation of the same species. Okay. Anybody want to venture? Leukocyte, melanocyte, xeroderma?
Not extend that way.
Yeah, is it xeroderma? The book? Okay. And then transplantation of the same. That's let's see, there's homograft, heterograft, autograft. That's going to be homograft. Yeah, or allograft. All right, leukocyte, melanocyte, xeroderma, and so this is talking about if you transplant. So if I'm in a car accident, God forbid, and they have to take skin from my leg and put it on my face, that is an autograft because they've taken skin from me, the patient, and putting it on me. If they take skin from you and put it on my face, that's a homograft or allograft. And if they take skin from a pig and put that on my back, swinograft, I like that. I like the way you think. But that would be a heterograft, or a different species. Because they can use, but then swinograft, I like that. Okay, so don't get confused. It's allo. It's weird because allo normally means different. All right, I'm not going to get confused on that. Okay. So a tumor composed of cancer, and this is skin. So let's see. We don't have time to be guessing every cancer. First of all, if it's a tumor, it's what's the suffix for a tumor? An oma. Okay. So that could be a carcinoma. Would that sound okay? And then skin condition associated with pus. Remember pyogenic? Does that mean it makes pus? Not to be confused with pyro, because I think that means well, no, but I think that means you have a fever. It induces heat, I think. I don't want to confuse you. Let's see what they have. And then flow, okay, so discharge or seborrhea. And then treatment with cold is the cryotherapy. Okay, so carcinoma, pyoderma. Okay, so pyo, there's our, and then skin condition would be derma. That makes sense. Discharge, seborrhea, and then cryotherapy. Does that all make sense for everybody? I'm sure if you read the book and look at the pictures, you can file those into your, just know, rhea means flow, derma means skin. The test will be easy. They have a normal condition of the dry or scaly skin. Think scaly, think fish. And it's an abnormal condition, so ichthyosis. And then pertaining to heat, thermal. Okay. Yeah, so ichthyosis. So remember, osis is an abnormal condition. Yeah. I feel bad for the Wadley people. Now it says I'm connected. But who am I connected to? Yeah, it's missing. Okay, so basal cell carcinoma, if you think about see here. So you've got the epidermis, the dermis, and then I don't want to mess you up, because the basal cells are the, these cells are on the, all right, we're going to put them here. These are our basal cells, and that's the basal cell layer of the epidermis. All right, it's the most common type of skin cancer. That's the thing you're going to remember. Flesh colored, early stage, and it's going to be irregular, can be brown. Usually they are in areas where you're exposed to sunlight. All right, slow growing and destructive. They rarely metastasize, which is good, but they are invasive, so they will keep going if you don't stop them. Most common in blonde, fair-skinned individuals. And that should be self-explanatory. All right, so signs and symptoms. Tumor mainly seen on sun-exposed areas. Blah, blah, blah. Pearly white or waxy bump, often with visible blood vessels. There's your waxy bump. Is that a glare of this? I don't know what that is.
Yeah, I was wondering.
That looks like... That looks like a glare. I don't know.
That's the doctor's light.
Yeah.
The circle light.
Yeah. That's what we're looking at right there. Okay. Bump may bleed, develop a crust, or form a depression in the center. So that's depression in the center. Yeah. Like I say, if they can catch that in time, you should be all right. Eradicate it. Depends. Cutterage and electrodesiccation. Cutterage is cutting it out. Electrodesiccation is using electricity to dry out the skin and kill it. Okay. We're not worried about treatment in here. This is though we don't have time. Cryotherapy. Using cold, like liquid nitrogen to freeze it. That'd be the cryotherapy. Laser therapy would burn it out. You could do chemotherapy, I guess. Surgical excision, that's what I would vote for. Just cut it off. All right, and these are useless. I don't like these. You know what we're gonna do? When you see these pop up, go to the last sentence. The spread of cancer from one part of the body to another is called metastasis. Thank you. All right. He is advised that the most common site of this skin cancer is, well, it's probably the face, because we're talking about basal cell carcinoma. Yeah, unless you walk around like that all day. Yeah. All right. The dermatologist charts the non-cancerous growth as benign. Benign means good. Cancerous means cancerous, and malignant means the opposite of benign, means it's bad cancer. Y'all know that, right? Benign and malignant. Okay. How should the nurse respond? Yeah. Okay. An abscess is a localized collection of pus at an infection, usually Staphylococcus. Most common sites are on hairy parts of the body, exposed to irritation, pressure, friction, or moisture. So they'll shave the hair away, and you get bacteria. It's a it's an abscess. Now, is that what we called a boil growing up? Yes. Okay. So basically, it's just a big infection pocket.
I've had that twice.
You have? Wow.
Yeah. It's gross. It
Um,
hurts really bad.
well, okay, so we have the furuncle or the carbuncle. The furuncle is the abscess in a hair follicle, and then if you have several of them bunched together, it makes the carbuncle. Which did you have?
But it can be, like, I had one in my tooth. I had
Okay.
this tooth that, like, I had one under my gum.
Mm-hmm.
And it, like, that didn't have to be, I guess, like, where hair is.
But it was a staph infection?
No, it was just, like, it was before I got, like, my big coffee.
Mm-hmm.
And it was under, like, my tooth, and it made my tooth, like, it rotted my tooth because it was an abscess. Like,
Mm-hmm.
and it had nothing to do, like, he said it had nothing to do with, like, brushing your teeth or anything. It was
Mhm.
just, like, some kind of bacteria that got in my gum.
Mm-hmm.
And I must have had, like, a cut or something. And he said it just got down in there, and it literally got
Interesting.
up under my
So
tooth.
that's-
And
'cause it
had,
could've-
like, a huge, like, pus pocket. Like, you could see it. It was
Yeah.
bad, but it wasn't, didn't have anything to do with, like, my hair.
Yeah, it's normally located.
Yeah.
Because think of it, because
All
hair
that
gets
on my
friction.
neck
Okay.
and on the back of my leg.
Well, for the sake of the book, a true furuncle, like you did not have a furuncle in your mouth, you had an abscess. Furuncle is an abscess in a hair follicle. And think about it, it's got the word fur in it, right? Fur. Hair, fur. Just remember that. Adjacent to subcutaneous tissue. A carbuncle is several furuncles developing in adjoining hair follicles with multiple drainage sinuses as shown in the illustration on the previous slide. See, this one's got lots of drainage points. So, yeah,
But
that's a...
does that matter when they go to get that out? Is it, because it has several places, would you still go to the one in the center because it's the largest? Or
See,
does
now
it
you're
matter?
thinking about cysts. I would think you would have to lyse every one of those and drain them all.
But because they feed into, I mean, just
Yeah.
looking at this, because it's the center is what we are seeing, even though I do see there's several.
Yeah.
When you would go to get rid of that or get the.
Actually, they probably, if you just apply, I mean, it's going to be painful.
Right.
You're going to do an antibiotic. You're going to clean it. You don't really, you may not even have to, I mean, I imagine if you just put pressure on it, it's going to express
Right.
the pus.
Just watch
From the method of least resistance. I think
Yeah.
it's just going to go where it goes.
Yeah.
Now, you're not going to have to individually clean out every one of those tubes because once you do the antibiotic, it's going to kill it off.
Okay.
And then hopefully this person, I don't know. I've never treated one. I'm just, but I would think that because of that was on the back of his neck, on the nape of his, probably with the hair and his
Right.
shirt, he just
Right.
needs to keep it cleaner. I don't know. Okay, so the difference, the difference between a furuncle, a boil, and a carbuncle. Blah, blah, blah. Pus. Yeah, okay. Oh, notice that you can't have a mild fever. I mean, it is a bacterial infection. Okay. Clean it with soap and water. Apply a hot, wet compress to promote vasodilation and drainage. Administering topical antibiotics, incision and drainage possibly necessary. Okay. The term to describe reddening of the skin. All right, let's see. What's skin? Well, see, really, it's oh, this is basal cell. German? It just seems too easy. I don't like that. I don't like that answer. I don't. Erythema or erythematous. I use that word all the time. I don't know why I was thinking. Because it's an adjective. Because you look at somebody's ear, like an ear canal, and the ear, like a little kid with an ear infection, and you say non-erythematous or it's erythematous if it's got blood vessels. I knew that. Anyway, that's the one you see that you actually use because it's either erythematous or non-erythematous. Upon diagnosis of a furuncle, the nurse explains that this is an infection caused by a bacterium. Yeah, you knew that. Okay. Charts a cluster of furuncles as a carbuncle. And think about all your uncles getting in a car. That's a carbuncle. Mrs. S is diagnosed with an abscess on her knee. She asked the physician to explain it. Oh, okay. You have an abscess on your knee, ma'am. That's I don't know how else to explain it to you. You try to draw a picture? You know, don't assume it's staph. Okay, so psoriasis, and you get like that scaly kind of white, silvery, that's the key word, silvery patches. It's chronic, non-infectious, inflammatory skin disease, circumscribed red patches covered by thick, dry, silvery, adherent scales as shown. And there's no pattern, I don't think, with psoriasis. With eczema, or no, with psoriasis can be, it's elbow patches, right? Elbows, knees? Yeah. So then this guy's case is really bad because it's spreading.
I have psoriasis in the back of my head. All
Really?
over my scalp.
I think I have it on my pinky starting.
It itches so bad.
Well, mine doesn't itch. It just gets, I think I have keratinosis.
It burns half the time.
Oh, then I don't have that. Okay. All right. How much time do we have? 45, 50 minutes? All right. We're halfway through. Okay, we can do this. All right. So the thing is, don't get psoriasis confused with eczema. Epidermal cells produce 6 to 9 times faster than normal. You know, I was talking about how these cells are growing. Okay. Family history. Now, this can, if you do have a history of psoriasis, did you ever have a history of asthma or allergic dermatitis, like allergies? Okay, because they usually those go like together. So it's like your immune system's a little too. It's like almost like a pre-autoimmune disease, or it is kind of like a. But take fish oil. And put fish oil on this dry.
I've tried everything on your
Okay.
It's awful.
Okay, so that's may begin at any age. Signs and symptoms. Excessive development of the basal layer. Affected areas that typically appear dry, cracked, and encrusted. Buildup of skin caused of living and dead tissue. Okay. Pruritus. That means itching. Did y'all know that? Pruritus. This means itching. Common sites on scalp, knees, elbows, umbilicus, and genitalia. Okay. All right. Treatment is palliatively. There's no cure. Palliative. You know what that means? It means we're basically making you feel better until you die. No. That's what it means. I mean, you know. Usually,
Don't they say that
with
in-
cancer, usually.
They say that with older people too.
Yes.
We're gonna offer palliative.
We're going to offer them palliative care, which, you know.
'Cause isn't that what hospice is?
Yes. That is exactly what hospice is. Topical meds, coal tar, vitamin D, corticosteroids, and wet dressings. We're not worried about that. It's a different class. Ultraviolet. Okay. Keep going. Okay, hyperkeratosis. Now this is what? Okay, so the cells that make the hardening of the cells is the hyperkeratosis. That's what I have on my pinky. It's that horny layer of the epidermis, and it's called it grows too much. Okay. So I need UV therapy. Okay. Mrs. M's at diagnosis. The most common site of psoriasis. Okay, the most common sites of psoriasis are scalp, elbows, knees, umbilicus, genitalia. Okay, you should know those. I mean, that's just a good thing to know. For chronic psoriasis, a powerful form of UV light. Yeah, no, I'm not worried about that. And the excimer laser. Yeah, I didn't know that. All right, now acne vulgaris is common inflammatory skin is sebaceous glands and their hair follicles. Comedos. This is what I want. Pimples, whiteheads, are called comedos. That's COMEDOS. And I don't know. I just think like comedy torpedoes. I don't get it. Why that word? But comedos means blackheads or whiteheads. A papule is just like anything that you can see poked up with like a little less than 1 centimeter. And pustules are small raised areas of the skin filled with pus, as shown. So a papule could just be a raised spot. Like that could be a papule right there, but that'd be a pustule right there, and that's one that's broken open. But that's not just your regular pimples and teenage pimples. This is acne vulgaris, is its own disease name. Face, chest, upper back, and shoulders, commonly caused by hormone changes during puberty, or you'll see it in predominantly males who are taking anabolic steroids. That's what anabolic. Underlying cause of genetic predisposition, blah blah blah. Okay. We all know. Okay, let's see. Comedo is a black head. A closed comedo is a white head. Color in the comedo is caused by the melanin produced by the hair follicle, not by dirt. Good to know. Because usually, the skin commercials they draw you that picture, and then they show you like, oh, you got all that dirt in your pore, right? And then take use our stuff, and it'll just lift it away. Right? This is it's crap. Yeah, okay. It's the melanin, not dirt. Who knew? All right, eventual enlargement and rupture or leak of the plug, spreading contents. Okay, that's just, yeah. Obviously, I hope nobody ever had to experience that. Decrease the bacterial count. I mean, now they do the retin-A, or what's it called?
That's right.
Retin-A?
There is a big one.
Yeah, and all that is retinoic acid, which is vitamin A. And the cool thing, what vitamin A does is it speeds up the genetic coding, so those cells just grow faster and slough off faster. So all that junk, it just speeds it up. Now, for women, you have to sign an affidavit saying that you have had your last 2 periods. You have to sign one for your doctor. You have to sign one for your pharmacist before they'll even prescribe it, because the chances of birth defects is so high. If you're taking that high of a dose of vitamin A and got pregnant, it'd be bad news. So you have to basically they're just covering their ass, or they're covering their CYA. So you sign that saying I'm not pregnant, and I'll give me my.
Isn't there tricycline or whatever? Is the birth control with supposedly the face clearing as well? And
Oh, does it?
Yeah.
I-
That's their promotion, and there are a lot of people
Did
that
it have vitamin A in it?
was in healthcare class with me that a girl literally got very, very, very sick because she was put on that because she had acne plus she needed the birth control portion. tricycline or something. You know what I'm saying? It's like this long word. I might not.
Well, just find it. Find that long word. This is medical terminology. This would be the perfect time to find that word.
It's something tricycling, but it's long. I think it's
Because
longer
see, like, because you got tricyclics are antidepressants. So it's not that. The tricyclic antidepressants. It's a whole category of serotonin reuptake inhibitors.
It is that. Y'all know what I'm saying? Y'all know what?
Does anybody?
It is that. I mean, it sounds like that. Then, if it's not, if I'm not saying it right.
Well, Google it. All right. We'll have to come back to that. Unfortunately, we've lost them. We won't make it to the female reproductive chapter to cover this because we've run out of weeks. But, okay. Snow. All right. Okay, so blackheads and whiteheads are called comedones. We've established that. We can keep going. Antibacterial. All right, scabies. All right. You don't see that a lot, but it is, and it just starts making you itch. It's a mite. It's an itch mite. It's like, yeah, and a skin-to-skin contact. Children in daycare get this. Transmitted by prolonged contact with infected clothing, bedding, or small cheap hotel rooms. Yeah. It's where you take your own sheets.
My friend actually had this, and he said he had scabies. And I thought he was kidding, because I didn't even know that was like a type of disease.
Yeah, it's a real thing. Yeah.
No, he was being serious.
You really had to. Like, don't touch me. I really. So you might. Did you like?
No, I didn't. No, I thought he was kidding.
Okay. Well, because you sit on their couch. You just.
I see a lot of, I work at a vet clinic and we have a lot of dogs that come in and they transfer it to their owners. Because
Yeah.
They just don't know and it's just gross.
Yeah, because they can go. They can go outside and just pick it up on the grass, and then you come in and they've rubbed it off. They don't mean to. All right, so scabies. Patient is asymptomatic while the parasite multiplies, and then it burrows into your skin and makes a short, wavy, brownish black line. I don't know if you have a picture of that or not.
It's orthotricycline.
Orthotricycline.
That's right.
All right, so orthometapara, tricycline. Well, they're, my chemistry's a little, that's telling us, cycline, I don't know, off the top of my head. Any chemistry whizzes in here that want to help us put this molecule together? No? All right. But that is a birth control pill that allegedly is also good for your skin?
Good for your skin. Yep.
And so, see, I think that that's just so that people can take birth control and not say they're on birth control.
Yeah, for the reasons that they want birth control. It has
Yeah.
nothing to do with their face.
Yeah. Which is fine. I mean, I'm not. I'm glad the society has a way to do that. You little tramp.
And then it says low at the end of it, so that's weird.
It says what?
It has that word that you just did, and then it says low. L-O.
What word?
The one we said.
The orthotricycline dash
And then it says
low.
low. I don't think it has to do anything with the definition, but I would just notice that.
All right, now I've got my curiosity. Orthotricycline. Okay, so it's Norgest. All right, orthotricycline low, ethinyl estradiol, Norgestinate. Doesn't say anything. It's just estrogen progesterone combo. Even on the website, it doesn't talk about the And it has all the normal side effects of,
Right.
don't smoke with
Weird.
it because it can cause blood clots. Okay, scabies, back to scabies. Itching and rash, major complaints. Keep going. How do you get rid of it? There's a scabicide, cream or lotion, scabicide. Pretty obvious that scabicide kills scabies or scabicide. Antipyretics, which means they what? They stop, it's anti-itching, yes. An oral antihistamine. So a girl goes to farm.
The way you say stuff's hilarious.
She goes to the farm. She's getting a rash. It's scabies. Okay, let's keep going. We'll have to, it's time. All right, impetigo. This is also contagious. It is, the key thing on impetigo is the vesicle makes a yellow crust. Because you see this stuff in pathology on your board exams later on, whatever you're doing. So you want to remember, fluid-filled blister that becomes pustular ruptures and forms a crust. So first you have the fluid-filled blister, and then you'll see, white buildup like pus. And then once it breaks, you get this yellow crust, which I don't really see. There may be some yellow crust right in there. So a vesicle is a small blister. A bulla is a large fluid-filled blister. So impetigo, and see, I always get this confused with what Michael Jackson had. What was
That's what I was thinking, because that is an N, right?
what is it?
Infantile?
No, it's not vertigo. Vertigo is when you lose your back.
It's
Vitiligo. Vitiligo. Yeah, vitiligo is where your melanocytes start just fading out, right? Yeah. And so vitiligo is different than because impetigo is contagious, but children get this like at daycare. Vitiligo is not contagious. Okay, so macules, vesicles, ruptures, honey-colored serous liquid. All right, so that's your key thing to remember. Impetigo, it's honey-colored. Makes a yellow crust. All right. Mouth, nose, neck, extremities, pulse or erythema with ulceration and scarring. So when you see erythema, what does that mean? Skin reddening. Yeah, red skin with ulcerations and scarring. Antibiotics, oral antibiotics, or both. Clean the lesions 2 or 3 times a day. Good hygiene. Don't touch anybody with it. All right. Okay, so here's an example question of someone who has impetigo. It's got a yellow crust. If it was in his hairline, we think furuncle. If it was on his elbows, we think psoriasis. Okay. Who knows what alopecia is? Yeah, it's balding. Mm-hmm. And then debridement. It's cleaning, debridement is cleaning either dead necrotic tissue or foreign objects out of a wound.
It's like when you get burned and they gotta scrape it.
They got to scrape it out, or if you're in a crack or a motorcycle wreck and they've got to get the gravel out of the.
Because isn't it painful?
Oh, it'd be horribly painful. Yeah.
Just to.
Hopefully you'll be unconscious. So removal of necrotized tissue from a traumatic or infected area using excisions, enzymes, that'd be good, or chemical agents used to promote healing and prevent infection. If you're ever out, this is like those, I don't know, but if you're ever out and you have a horrible wound and the flies come, the maggots only eat the dead tissue, and it's actually good for you. So let them do their thing.
I saw that with patients like with severe diabetes, and they will put those in there to eat that flesh on their, off their feet.
Yeah. And we fly to the moon and back, but we still use maggots to win. It's amazing. Okay, diaphoresis. I think this means what? I think it means sweaty. Does it mean sweaty?
Excessive.
Excessive sweat. And then hirsutism, you may know what that is? All right, he is hirsute. That's a clue. Yeah, usually means you've got hairy. So, hirsute means, well, excessive growth of hair in unusual places. No, hirsutism. See, notice if it has ism, it becomes a condition. Usually, in women, hirsutism is an issue because it's a hormonal issue.
And isn't it usually for the women, isn't it on the face?
Yeah. Well, I guess. I mean, I don't.
I mean,
I would.
I've seen
That's
people
the
that
place I will notice it. So,
Like a beard, like
yeah,
it's
you know.
for that, like-
Yeah, because as you, like when you hit menopause, your estrogen levels drop, and you already have a little bit of testosterone anyway, and so, and it's funny because there's this, like you work with old people in geriatric homes. The kind of the joke is that when they get really old, they basically women turn into little men and men turn into women because women's lose their estrogen and start getting hairy, and men kind of lose their testosterone and just kind of like they just turn into this one person. Anyway, enjoy it while you got them. Anyways, okay, diaphoresis, you need to know this. It's excessive sweat, unpredictable even when the temperature is cold. That's not flop sweat though, because flop sweat's through stress. That's like a sympathetic nervous system response. Diaphoresis is just, it can be hormonal, it can be a nerve problem. All right, debridement is the removal of foreign material and dead or damaged tissue. And then Mohs surgery is, this is one of those terms that honestly I saw here first time. I'm not worried about Mohs surgery unless you're going into that. Here's our grafts. We talked about this. Allograft, autograft, synthetic, and xenograft. Okay, allograft would be the same thing as homograft. So that's my skin, no, some other human coming to you. Autograft is using your own skin. Synthetic would just be something they've made in the lab. And then a xenograft is from another species, which is also heterograft. But remember xenophobia? You heard that word xenophobia? That's when you're like paranoid of other cultures, other people. Yeah, I mean sometimes xenophobia is like racism. Is people are being xenophobic? You'll see that word thrown around there. So a xenograft is an other. It doesn't have to be another people. I mean, it's still other species. But just the way you see these words. A xenophobe, yeah, it's like a neo-Nazi. Yeah. Okay. Necrosed material is debridement. Verrucae on her left hand. You know what a verrucae is? Verruca? Or I think it's warts. Isn't that warts? Yeah. So she's diagnosed with, in plural because it's AE. See, they just threw that out brought that out of left field. The dermatologist freezes and destroys the lesion with nitrogen. That is called crown surgery. But let's look up verruca. Well, they're saying on there that's plantar's warts. And that's something else y'all should know. You've heard of plantar's warts? And on the bottom of your foot? Has nothing to do with planting vegetables. I didn't know that.
It's T-A-R, right?
T-A-R. That's just the bottom surface of your foot is the plantar surface.
Is it,
Yeah.
is it like inside your foot?
It's
It's not a ball.
yeah. It's very common.
And it has a long root system because when you pull that bad boy out, there's blood from all get out. Talking about a plantar's wart.
Yeah.
It has a black
Yeah.
piece in it.
But you actually pulled your own out?
We did it
You have to.
two step one that happened.
Oh,
It was
okay.
like really painful when we were
Yeah.
on a youth trip, and it's black. It almost
Yeah.
looks like a thorn because it does.
Yeah.
It's not your flesh
Yeah.
color, and you pull it out, and wow.
I used to
Okay.
do gymnastics like the mats, like all sweat. And I like all of the bottom of my feet.
Yeah.
I
It's
have a
really
scar
hard
from
and it
pulling
hurts a
one
lot.
out. Like it looks like an indentation in my skin.
Okay, so apparently very common. That's all. Oh, we're going to knock this chapter out, which means we can have our test next week. All right, the surgeon informs Mrs. T layer by layer. That's that Mohs surgery, which I don't know. Mr. X is for the pus will be removed from her abscess by incising and draining it. The procedure is abbreviated as C and D, Cutteridge and I don't do surgery. Oh, incising and draining, I and D. Okay, that's pretty. Okay. I'm going to do a walk, W and T. I'm walking and talking. It's like, okay, Mr. X, a burn patient, is given a transplant of healthy tissue from his son. What kind of transplant? Homograft or allograft. Suffers from chemical burns. Is healthy tissue transplanted from a pig? That would be a heterograft or a xenograft. Very good. All right. So the skin prick test is where they put usually different food allergens in each of these things, and then they stick it on your back and see what you react to. Anybody had that done? Mm-hmm. Oh, so it's pretty common. Okay. It's a scratch test. Blah blah blah. That's what it is. And then the intradermal allergy skin test. They do subcutaneous injections and look for a reaction there. And then that's anybody else have anything to elaborate on that? Either you have a reaction or you don't. No. Biopsy. That's when we cut something out to look at it in a lab for microscopic examination. Usually to establish a diagnosis. Yeah. Instruments to cut pertaining to within the skin, study of skin. Dermatome, intradermal, I don't know, and then dermatology. Dermatome or dermatotome, either of those is acceptable. So instrument to cut is always a tome. Pertaining to intradermal study of skin is dermatology. All right, so you have antibiotics, antifungals, antipyretics, and corticosteroids. Does anybody need to elaborate on these? These kill bacteria, these kill fungi, this makes you not itch, and these are anti-inflammatories. Right?
Yeah.
Okay. Bacterial skin infection, you're going to use, okay, you have bacterial skin infection, you're going to use a antibiotic. Poison ivy rash, corticosteroid. Yes. Very good. Ringworm, fungal, yes. And rash between his toes is done with the athlete's foot. That's also antifungal. Y'all don't need it, but it's kind of interesting. All right. It all starts tinea capitis. Capitis means head. Tinea capitis is dandruff. True dandruff, not dry scalp, because everybody thinks they have dandruff. It's actually, dandruff is a fungal infection. So tinea capitis. If you have tinea corporis, corporis means body, like Corpus Christi, body of Christ. Tinea corporis, that's ringworm. Okay. Tinea curis is jock itch, and then tinea pedis. Pedis is foot, is athlete's foot. All the same family of fungus. It's all the same species, really, but they live in different parts of your body, and you can't spread it to the different parts. You can't get athlete's foot on your head just by touching your head. They're related, but it's all in the same genus. And you can't, like the point is, you can't spread it by touching different parts. But it is kind of neat that it's all the same thing. Okay. And that's the end of that. All right, so that means, before y'all rush out of here, okay, so that stops